Hello, and welcome to the Care Conversations podcast. My name's Jesse. I'm the Communications Manager here at Sioux Meno Health Center, and I'm your host. Each episode, we'll be giving you a peek behind the scenes of what we do here at Sioux Meno Health Center. This episode, we're excited to be joined by Cynthia Dwyer, our Chief Nursing Executive. She'll be sharing us the ins and outs of how, from the top down, Sioux Meno Health Center prioritizes nursing policies and processes and how we adapt them on a day-to-day basis to meet the needs of not just our nursing staff, but our patients. She'll also be elaborating on not just the nursing practicing needs of our staff and patients, but also the cultural needs of our patients and how we prioritize those as well here at Sioux Meno Health Center. I'm joined with Cynthia Dwyer, our Chief Nursing Executive. Thank you for joining us today, Cynthia. Just to get started, I would just wanted to find out more about just your role as the Chief Nursing Executive.
All right. Well, thank you, Jesse, for inviting me, and I appreciate the question. As the Chief Nursing Executive, it's my responsibility to ensure that all the nurses are practicing to the College of Nurses standards and ensure that we are providing culturally appropriate care when needed. I am responsible to ensure that we have mechanisms and policies and procedures in place that ensure we are providing safe care here at the hospital. I sit on the executive team to make sure that patients' voices and healthcare provider voices are being heard at the executive level. I also sit on the board of directors to also provide them insight into any nursing issues, patient concerns, or any standards that we need to change, and also be a resource for them to ask me questions about any practice issues that we might be having.
No, that's great, and just even elaborating more in terms of you being a resource, just just day to day, how do you assist our managers and our nursing staff just as they deal with the busyness and just the day to day flow of the nursing floor?
How I assist them, Jesse, is when there is an issue that comes up that the manager might not quite know how to handle. They go to the director, and then the director will come to me, and then we will discuss the best way to approach the situation. If it's a patient complaint and they're, not quite sure how to approach the patient, if there's a practice issue that they're not quite sure how to also address, or if they come and say, we keep having this continued issue with something that say the nurses keep having the same mistake. Taking a look at our processes and say, okay, let's sit down. Where is the gap? Where is the gap in knowledge? Where is the gap in skill? And how can we close those gaps? They'll come to me, and it's my responsibility to help them work through to make policies and processes that we can address those gaps and to make sure that we are providing safe care. When our ER starts getting backed up, if we start looking at a regional approach, because part of my job as a CNE is to also sit on regional and provincial committees, is to reach out to the region when our ER starts backing up and saying, okay, this is where we're sitting. We are at census on the floor. We are having to offload patients into our day med. We need some help here. And then I start reaching out to our partners to see how we can address the backing up of the ER. And I just say to the managers, leave that with me, because I need them to go back and to make sure that the patient's needs are being addressed. And so that's at a higher level. That's how I help them every day with their duties.
No, that's great. And I know just in terms of our nursing floor, there's some complexities just with the care that we do provide, and just some intricacies within that. And, between the care that we provide on our nursing floor and just the kind of nursing environment in our region, just how does that compare to more urban centers when we look at, just the kind of nursing environment we have in our region compared to more like city centers?
One thing that makes us very unique and different, and I think it's something that makes us one of the big benefits of working here. Urban centers, when you go to a larger hospital, the nursing there is very specific. You either work on an oncology unit or you work on a cardiac floor. You can work on a palliative unit. Here, the nursing floor looks after all patients. So a nurse can come in and their assignment for the day might be a palliative patient, a pediatric patient. They might have someone that's here for gallbladder issues. So they get the whole gamut. And I think that's where we kind of differ from bigger centers, that our nurses are more well-rounded in their nursing skills and their assessments, because they have to know almost and be prepared to provide care to any patient that comes on our nursing unit. And so when we have nurses that are thinking about coming here, I always say that to them. If you come here and spend time with us, you'll be able to go work on any unit, on any larger hospital, because you're going to get that more in-depth skills and knowledge and more well-rounded nursing skills, as opposed to a big center. You might go and you'll just do, let's say, cardiac. And then you're not learning about pediatrics. You're not learning about palliative care. Where I think our nurses are a little bit more well-rounded, and I think that's a big benefit of working here.
No, and that's what I was going to be elaborating on next. I guess for nurses, in terms of wanting to get that fulfillment and maybe just that variety in their work, I guess there would be benefits in that as well. Just being able to come in every day and have that wide scope, as opposed to just sticking with one thing on a day-to-day basis. Yeah,
and the other thing that I think is very, very beneficial here is we really expect our staff to think outside the box. In the larger centers, they have all the bells and whistles that we don't, and so with the population that we serve, given the remoteness, the lack of resources, we really expect our nurses to try to, like I said, think outside the box, problem solve, to see how can we better serve the clients and the patients without some of the more advanced technology that some of the bigger centers have, or the supports. In bigger centers, they all have code blue teams. So that's all that team does, is come in and run codes. Some larger centers have IV teams. That's all they do all day is start IVs. Our nurses have to do it all. They are the code blue team. They are the IV team. So I think that's very unique, and for smaller centers, that the nurses have to be so well-rounded in their critical thinking and their skill set, that I think that makes them better nurses.
And would the cultural aspect as well really even further just give them that more depth in their practice, as far as not just having to think outside the box in terms of technology with their practice, but also trying to think of the patient and their culture first and foremost as well? Absolutely.
And I think it's important for the nurses to be very, very mindful of the population that we serve, and given the complexities that comes with that, in distance, in lack of resources, and to understand that each patient comes as an individual, and that with those individuals come their own unique cultural needs and own health needs. And to think, when we say think outside the box, is to keep that in mind when we are providing that care, that one size doesn't fit all. And just because someone this might work for this one patient, might not work for the other patient. And we have to ensure that we are meeting the cultural needs of our patient. And that cultural need could be incorporating traditional medicine in with Western medicine. And we expect the nurses to be very open-minded about that, to explore that with the patient, and to see how they can meet those needs of the patient.
No, that's perfect. Well, I appreciate your time and joining us, Cynthia, and thank you for sharing that. It's good to know that just from the top down, that these are definitely the priorities of the organization, and that we're always looking at different ways to kind of approach that nursing standpoint, and even just looking at different policies and processes and how we can keep adapting to our patients' needs.
Absolutely. And when you mentioned meeting their needs, one of the things that we make sure all the nurses here attend Anishinaabe training, because we want them to make sure that they understand the importance of understanding the population that we serve, and that the unique needs they have, and that and it's my responsibility to make sure that those nurses understand that and respect it, and provide the culturally appropriate care when required.
No, that's fantastic. Thank you, Cynthia, and we appreciate you joining us, and thank you for your time.
Thank you.
Miigwech, thank you for tuning into this episode of the Care Conversations podcast. If you've missed a previous episode, or you want to rewatch an episode, feel free to tune in on our YouTube channel at Meno. To stay up to date on all things Sioux at Meno Health Center, follow us on social media at the same handle, @Meno. We look forward to bringing you more episodes. Until next time, stay safe and take care.